Okay, Uncivilized Anatomy, video number 3. We're talking about the vertebral column, the spinal cord relationship to the backbone. So let's talk about the intervertebral discs, IVD. So these discs are little fibrocartilaginous discs that are in between the round sort of short barrel structures that are the body of the vertebra. All right. If I just draw kind of a square, we're going to look at this. We're looking at this from the side. In between each of those blocks is this little, relatively thin, kind of bulges out a little bit, disc. All right, and it sits in there, and I'm drawing these obviously exaggerated in their size, but the vertebra sits on a disc. Typically, the vertebra sits on its own disc. So if this were T5, this would be the T5 disc. To, if you're going to forget that, or to be very clear, you would refer to this disc as the T5, T6 disc. That way I know for sure it's between T5 and T6. If you just were to say the T5 disc, I would assume you meant the one below that the vertebra is sitting on. Otherwise, just say T5, T6 disc. When I say so-and-so has a herniation of the L4 disc, I mean the one above L5 and below L4. So inferior to L4, superior to L5, or just L4 disc. All right, so these intervertebral discs work like this. Okay, so from the side, it's kind of a roundish structure, and in the center of this structure, there's a little pocket of this gooey, incompressible, sealed off material called the nucleus pulposus. The nucleus pulposus. Just so you get from the name, it's in the center, the nucleus, and it's kind of pulpy. This is the remnants of a fetal nodal cord, which we can get into in yet another video. Around the nucleus pulposus, you have concentric rings of tough fibrocartilaginous laminated sort of concentric rings. So it wraps all the way around this. Okay, nucleus pulposus is sealed off on the inside. If we looked at this lateral view here, I drew the nucleus pulposus would kind of be floating in the middle. So it's sealed over the top and bottom by the bony end plates of the superior and inferior vertebra and a little bit of this fibrocartilaginous disc, and that nucleus pulposus stays in there. Okay, and then it's surrounded by these cartilaginous rings. Now, the intervertebral discs, let me tell you this. The concentric rings are called the annulus fibrosus. Nucleus pulposus, annulus fibrosus. The going around the fibrous rings that go around the pulpy nucleus. Okay, that's the two parts of an intervertebral disc. Okay. The intervertebral discs are going to form a really unique type of joint between the different vertebra. People would tell you that they're shock absorbers. They're incompressible because of the concentric layers of fiber and fibrocartilaginous material, and the fact that nucleus pulposus can't be squished, so it's kind of hydraulic. I wouldn't call them shock absorbers, although that's typically what they'll tell you. But they will, because of their internal structure, provide the ability between two vertebral bodies to rotate, to laterally flex and extend in the sagittal plane, even a little bit of distraction, pulling the vertebral bodies apart. It forms a really multiplanar joint with each of the two vertebral bodies that it's between. Obviously, it bears some weight, but most of the shock absorbing qualities of your vertebral column are through the real thin trabecular end plates of the vertebral body. You can think of the vertebral body almost as like that cortical bone, like a ring of really heavy duty bone, and over the top and the bottom, inside is full of spongy trabeculated bone, and then there's a thin end plate that's at the top and bottom of the vertebral barrel that closes it off, and it's like a thin thin layer of really trabeculated bone. And since it's thin, you can think of this as acting almost like, because it will deform a little bit when the intervertebral disc gets a lot of pressure and presses down into that bony end plate, top and bottom, and it acts almost like a thin, bony trampoline. So that's where you get a lot of shock distribution or dispensation to get rid of some of that force. Not necessarily the disc itself, but the disc acts as a medium to convey that vertical compressive force onto those thin, bony end plates. You can get, there's all sorts of genetic, like Schmorl's nodes and other sort of defects you can pick up in those end plates that go down into the body. It's not hollow, it's trabeculated all the way through. But it surrounds that core, or it is surrounded by that core of compact bone. And then inside there, we'll get to that in another video. But the shock absorbers are not necessarily the intervertebral discs themselves. They've got the springy, thin end plate of bone in the vertebral body that provides some of that shock absorption. And that's why when you fall, you're more likely, if you were to sit right down on your tailbone on an icy sidewalk and you fall straight down, you're 85 years old, you're more likely to fracture the bony end plates or the vertebral body itself than you are to rupture a disc from a fall. Most discs are ruptured by being put under torsional pressures and shear forces than they are compression. Okay, so where were they? Okay, so the disc itself. Let's talk about the structure there. Okay. So it's made up of those concentric rings, and the way it's built, the internal architecture that lends it to the great variety of movements you can get out of that joint is that each of the, let's do a different color. Here's my nucleus pulposus, little glob of notochord leftover goo. That's actually interesting too. We'll come back to that in a minute. And then around that, it's encapsulated. And then I've got a layer of fibrocartilaginous annulus fibrosus. And this first layer is going to have its cartilaginous fibers oriented in a radial, an oblique radial fashion. So if you looked at this from the side, this layer would have its main fibers sort of tilting. In this case, I've got them tilting back in a counterclockwise direction, right? So they're tilted posteriorly. If we look at this from the left side. Okay. The next layer, then there would be another layer of annulus fibrosus around that, and its fibers would be oriented exactly 90 degrees to that layer. So the next layer I'd have over this, in the green, the fibers would be slanted back the other way, going clockwise. And then this pattern would continue. The next layer out would be going the same as the first, and then the fourth layer out would be going the same as the second. So they'd be oriented in different directions, and you get this constant overlapping of the fibers, so that when you get a, let's say, I rotate. If we're looking at this from the rear, I rotate to my right. The intervertebral discs, the individual fibers in those layers of annulus fibrosus are going to be pulled forward. So if I were to turn this way, the black fibers on that first layer would be pulled into an upright position, while the fibers in that superficial green layer would actually be pulled further into an oblique, almost parallel orientation. So what this does is now all the layers 1, 3, 5, 7 that are oriented in the direction I'm going would become more taut. They would take more tension, whereas the concentric superficial layers 2, 4, 6, and 8, they were already oriented that direction, would be pulled in such a way that they become more slack. So at any time, let's say I have 10 layers of annulus fibrosus, at least half of those layers are resisting movement in whatever direction I torque, to the right or the left. When I pull in a tensile way, superior and inferior, all the fibers would stand up and resist that. So now I've got all 10 layers resisting. If I were to compress And the fibers that lay opposite to each other, when they're being pushed more vertical, I get all 10 layers resisting compression. Shear force is the same thing, depending on the orientation of the fibers. When the disc is, forces act upon the disc, at least half of them are going to be engaged in protecting us, countermanding that particular movement. Tension, compression, shear forces, almost all of the disc acts there, which is why you're most likely to herniate a disc or damage annulus fibrosis with torsional movements. So as a chiropractic physician, I tell patients, you can bend, you can twist, but it's best if you don't bend and twist under load. All right, that's how discs get ruptured. Now, the intervertebral disc doesn't have a great blood supply. It's fibrocartilaginous, after all. So one of the ways it gets its nutrients, like any other cartilaginous structure, like the meniscus, is through imbibition. So you stand up in gravity all day and you're slowly compressing and squeezing fluid out of the disc. Then when you lay down at night and you're out of gravity, the disc will imbibe or pull fluid, interstitial fluids in, and exchange nutrients that way. Kind of a slow squeeze and draw in effect. Squeeze and draw in. That's why another reason it's important to get sleep, at least lying down out of gravity, or spend some time out of gravity, to give those discs a chance to imbibe some fresh fluid. That's also why you're just a little bit taller, especially when you're younger, a little bit taller in the morning, centimeter or so, taller in the morning than over the course of the day as you wear down. Extend that out over the course of a lifetime. That's why people tend to be sometimes up to 2 inches, typically half an inch to inch shorter in their 70s and 80s than they were in their 20s. Because after that slow compression and imbibition over a lifetime, those discs become less pliant. They just wear out a little bit, and you end up being a little less tall. This is why it's good to take the opportunity, especially if you stand or sit all day, to decompress your spine. You can do that by hanging and gently tractioning the spine. You can do that by getting down a long lying position. Otherwise, just sleeping a normal amount at night typically takes care of that. It's another reason I recommend as firm a surface as possible, because you don't want to sink down into something overly soft, like one of those memory foam or water beds, because then you're still getting some compression on certain aspects of the disc as opposed to laying flat. All right, so we got these concentric rings of annulus fibrosis around the nucleus pulposus. Now, we're looking at this from a superior or inferior view, however you want to think about it. Remember, this would be sandwiched between two vertebral bodies. We'd have a block above, and here's that intervertebral disc between the two. We've removed the bones, we're looking at it. If you damage or get excessive force through that disc, use it improperly, shear forces, rotational, you'll get what's called a ruptured or herniated disc. Now, a lot of times if the disc is misused or mistreated, the nucleus pulposus will move from the center toward, be kind of squished over to one side, typically posterior or lateral or posterolateral aspect of the disc. It'll kind of squeak back here a little bit because of constant slumping in your chair or poor posture or misuse of your back and overly tight muscles. And that disc will tend to, as the vertebral bodies kind of angle toward each other, that disc will end up bulging from the back. So bulging disc is not necessarily a torn disc yet, but it's definitely setting you up for a torn disc. Do that backwards. So you'd be kind of slanting toward the front, which would put the squeeze here on the anterior aspects of the body and sort of force that disc to bulge out the back. Now, if you herniate or rip the annulus fibrosis, these concentric layers can be damaged individually or all at once in a catastrophic injury, but nucleus pulposus will start to leak out and maybe work its way along the laminar nature of this disc until it finally squeezes out and starts to exit the disc. It'll work its way through those layers in the disc until you get a big glob, a big droplet of the nucleus pulposus that has wormed its way through the torn annulus fibrosis or desiccated or damaged annulus fibrosis and made its way out of the intervertebral disc structure. Typically, just because of the way we're built, it's going to move posterior, lateral, or posterior lateral. Very rarely does it move to the front. There's also ligaments around the vertebral column we're going to talk about in another video that you see it has to work its way around. Because this nucleus pulposus is notochord remnant from the fetal structure, for whatever reason, it's highly inflammatory. So when it gets into an area where your immune system is going to sense it or detect it, it shouldn't be here. You'll set off a very robust inflammatory response, which will have implications for the pain-sensitive structures around it. It's going to cause you a lot of back pain. You're also going to lose that hydraulic capacity for compression resistance in that disc once the jelly has squeezed out of your donut, and your discs are going to start to, or your vertebral bodies are going to start to not work as well. Causes a tremendous amount of pain, affects your mechanics, the mechanical ability to stand upright in gravity and move around, do any kind of work. It affects that greatly. This would be a herniated. If that little bit gets nipped off, now you've got a sequestered bleb of annulus, of nucleus pulposus floating around. And if you remember from one of the other videos, back here, here's a pedicle, inferior articular process, superior articular process, another pedicle, and you got these SPs that sort of stick out here. That's going to be projected to the rear into the neural canal, or the spinal canal that's formed by the neural arch. So you're going to be impacting right around here by the IVFs. You're going to be impacting spinal nerves, nerve roots as they leave the vertebral column. You might be impacting the spinal cord itself. You might be bulging into the IVF and impacting vascular exchange. There's lots of bad things that can happen with a herniated disc. Right? Your discs need decompression, they need hydration, and they need a lot of movement to make sure that you're using them in a variety of planes and directions of movement, so you can keep your spine supple and healthy. All right, so that's the intervertebral disc, nucleus pulposus, the annulus fibrosus, and what it means to herniate a disc. Let's go back to the vertebral column in the next video, and we'll throw some costal elements on there, and then we'll go into the IVF a little bit more.